The OhioHealth Runners Clinic was designed by runners for runners with the goal of trying to decrease the risk of injury and also trying to improve performance. There aren't a lot of clinics that have incorporated physicians with athletic trainers and physical therapists and sports nutritionists. And we really wanted to build here at OhioHealth a multidisciplinary team of experts. Running is associated with injuries, and anywhere from a third to a half of runners will become injured each year.
My injuries started 2 years ago. I went to see an orthopedic doctor thinking that that's where I should be. And he told me that if I continued to do what I was doing, he would see me on the operating table and that I needed a sports medicine doctor, which brought me to Dr. Bright.
365 days a year, you're out there running on the trail. You know what they're going through, and so when they're getting close to a race and they're very anxious about running that race, they don't want to hear they can't run it, and I understand that. And I think it's a matter of finding ways that we can keep them going and get them to accomplish their goal.
Dr. Bright recommended that I attend the Runners Clinic. We looked at my shoes that I was wearing, my nutrition, pinpointed where my problem all started.
And so we were able to take her through the Runners Clinic, looking at the gait analysis and doing the strength assessment, and we were able to identify some areas of weakness that we needed to focus on.
Having the whole team surrounding me to find out what was happening when I was running. It was very informative.
We use motion analysis cameras from the back and from the side, and some special software. We're able to slow the gait down frame by frame and identify any imbalances or muscular weaknesses, and really kind of hone in on anything that could be setting them up for injury in the future.
And when I watched the video, I was amazed at what my body is actually doing to make up for the weakness that I had.
We do a gait analysis with a force plate, where we have them walk across a force plate, and we're able to map out their foot mechanics, look at their arch, and from there they meet with a running shoe specialist to really kind of incorporate that data into a proper shoe selection.
My running goals right now are to be healthy and strong and injury-free. I feel that I'm getting stronger. I'm running again. I did my first speed session. So instead of putting Band-Aids on the injuries that I've been having, got down to the root of the problem, and now we can fix it, and I feel great.
I think it's helpful when you've kind of been there yourself, kind of know the injury, know what it's going to take in order to get better. That can help patients as they try to understand what they need to do in order to get better.
I love OhioHealth's Runners Clinic. I've recommended it to all of my running friends.
Being a medical director for a lot of the races in town, it's always enjoyable to see the runners that I've seen in the office end up coming through the finish line. We know we've been able to be a special part of their journey, and it's always nice to see the smiles on their face when they're able to achieve what they set out to do.